Thank you, Dr. Monto. An awful lot has been said that's very, very interesting and that I agree with, and I'd like to make a few comments. I think the likelihood that this vaccine is going to be effective is pretty likely in the 6 to 11-year-old age group. The issue is side effects or adverse events that might be occurring after this vaccine. And I'm torn. On one hand, we know that many mothers and fathers and parents are eager to administer this vaccine to children because they're so frightened, perhaps overly so, but they're so nervous about this vaccine because of what's been stated, that they really are anticipating having access to this vaccine in children. On the other hand, I think we saw that approximately 68% of the children who are hospitalized with COVID-19 have underlying comorbidities. So that means about 32% do not. And then if we were to take 40% of that group that may have immunity already, we're getting down to a very small percent of otherwise healthy 6 to 11-year-old children who might derive some benefit. And we simply don't know what the side effects are going to be. We don't, for example, it's not even clear that this vaccine will reduce rates of transmission. We're hoping that's the case, but we don't know. This vaccine is probably not going to prevent infection. It's going to prevent severe disease. So my worry is that I think my thought is that this vaccine should be available for those parents who are very eager to get it for their child, and because their child has a comorbidity, or they're concerned themselves. But I'm just worried that if we say yes, that the states are going to mandate administration of this vaccine to children in order to go to school, and I do not agree with that. I think that would be an error at this time until we get more information about the safety. So I think I agree with what everyone else is saying here. We're in a very difficult decision-making process. Over.
So I think.
So this is right out of the comorbidity package insert, and as you can see here, where I highlighted. 12 through 17 years of age, although cases required intensive care support, available data from short-term follow-up suggests that most individuals have had resolution of symptoms with conservative management. Information is not yet available about potential long-term sequelae. The CDC has published considerations related to myocarditis and pericarditis after vaccination, including for vaccination of individuals with a history of myocarditis. The point to remember here, guys, is they don't have that data. And what just came out, and I'm going to show you this came out of Aaron Siri. If you're not following Aaron Siri on Substack, I highly suggest that you do. That's Aaron Siri, and he works a lot with I Can Decide, another great organization that if you're not familiar with I Can Decide and the High Wire with Del Bigtree, if you're following me, you probably are familiar with those things. But if you're not, and you're just we all just connected, I Can Decide is a great organization with information and tools to help you say no to these mandates, as well as reporting injury to the VAERS reporting system. And they are also suing the government. So this just out from Aaron Siri, and I wanted to share with you because I found it very interesting that OSHA is requesting, I'm sorry, not OSHA, I got to talk about OSHA too, But the FDA is requesting till 2075 to release the documents from Pfizer that they use to approve comorbidity. And let me just reiterate again that comorbidity is not even available in the United States right now. That jab is in Europe. Now, the company, Pfizer, says those jabs are all the same, but they're not. There is a difference to that. What that full difference is, we're not really sure, because they don't have to give us all of the details of their ingredients. They give us a basic list. But because of proprietary rights over information, they can keep that private from you, while at the same time mandating it. So I want to share with you guys, let me pull this up over here. I apologize as I get my screen together. So, oops. I'm on the wrong thing here. So I wanted to share with you, hold on while I pull this up. I wanted to share with you a couple of things. The OSHA ruling and also Aaron's series, what he just released here, where we found out that OSHA, I keep saying OSHA when I want to say the FDA. So here it is. Let me pull this up for you guys. Hold on a second while I switch screens live in real time. So this is the OSHA. Thank you, the Kiki here on Twitter, for sharing this, because this was great news. I also follow an Aaron Siri on Substack, so I get his emails in my email too. You can follow Aaron Siri on Substack as well. But here is what is really fascinating, and why everybody should be asking lots of questions why this is the case. As explained in a prior article, the FDA repeatedly promised full transparency with regard to COVID-19 vaccines, including reaffirming the FDA's commitment to transparency when licensing Pfizer's COVID-19 vaccine. And I would think transparency would also include why you have two different vaccines here. You have comorbidity and you have the B2, the BioNTech BH162B2 is the name of that one. That's a big question in my mind all about that. Let me continue here. With that promise in mind, in August and immediately following approval of the vaccine, more than 30 academics, professors, and scientists from the country's most prestigious universities requested the data and information submitted to the FDA by Pfizer to license its COVID-19 vaccine. The FDA's response? It produced nothing. So in September, my firm filed a lawsuit against the FDA on behalf of this group to demand this information. To date, almost 3 months after it licensed Pfizer's vaccine, the FDA has not released a single page, not one. Instead, 2 days ago, the FDA asked a federal judge to give it until 2076 to fully produce this information. The FDA asked the judge to let it produce the 329,000 pages of documents Pfizer provided to the FDA to license its vaccine at the rate of 500 pages per month, which means its production would not be completed earlier than 2076. The FDA's promise of transparency is, to put it mildly, a pile of illusions. Well, he's definitely putting it mildly, because I would definitely say that's a pile of, I won't say it. Can you believe that? Because I sure as heck can't. I've got another video from the FDA's approval process with the children, and I'm amazed that so many parents haven't seen this. And one of the things that I'm really worried about and concerned about is the amount of children I'm seeing pictures of them put up online, proclaiming that they got the jab, and they're putting the pictures of their children up online. And I think to myself, wow. So I want to play you, this is another video that with the FDA. So I cut these little clips up and have been putting them out there so people can see that, because our media is failing us. And I've said this before, and I'm going to say it again. The Smith-Mund Modernization Act is how and why our media is being used against us to manipulate the public. To manipulate the public with these narratives that are not based in reality and facts, as much as the media proclaims that it's all about, factual information and debunking misinformation, when it's the farthest thing from the truth. The media is absolutely pathetic. I'm calling you out. Any journalist working for the mainstream media, how do you live with yourself every day? Because this isn't journalism. But the media is not going to play this for you. So this is the FDA talking about the EUA approval for children who, by the way, have a 99.9% recovery rates. They are not arbiters of disease and going to make you sick. I cannot even believe the things I've heard out of people that I know blaming children for grandparents' death. That's sick. And I'm going to say it. It's sick. What's wrong with you? Stunad. Anyway, here we go.
Thank you.
Thanks, Dr. Monto. This is a much tougher one, I think, than we had expected coming into it. The data show that the vaccine works and it's pretty safe, at least by immunobridging and even by some clinical data, some early clinical data. And yet, we're worried about all of these. We're worried about a side effect that we can't measure yet, but it's probably real. And we see a benefit that isn't the same as it is in older age groups. So for me, I think it's going to revolve around two questions. First off, whether there is going to be a use for this vaccine in this age group, and then how the decision gets made to use it within this age group. And I think what sways me here is that is a very sort of personal choice. If I had a child who was a transplant recipient, I would really want to be able to use a vaccine like this. And there are certainly kids who probably should be vaccinated. The question of how broadly to use it, though, I think is a substantial one. And I know it's not our question, but I know we're kind of punting that to ACIP. But I do think that it's a relatively close call. And as Dr. Levy just said, as Dr. Gann said, it really is going to be a question of what the prevailing conditions are. But we're never going to learn about how safe the vaccine is unless we start giving it. That's just the way it goes. That's how we found out about rare complications of other vaccines like the rotavirus vaccine. And I do think that we are going to, I do think we should vote to approve it.
Did you hear that? So you won't know if there's a problem until there's a problem. So with the RSV vaccine, basically, that killed children, okay? And then they took it off of the market. So California has already said that they're going to mandate this. And we've got other states, Connecticut wants to mandate it. They're going to wait. The DPH says, we're just going to wait a little while. Meanwhile, parents are rushing out to get this. I'm seeing it all over my feed. I mean, I see people and it breaks my heart. And I don't know there's nothing I can say. There's nothing I can say. It's not my place to go and tell somebody what to do with their child. That's not my place. I can't do that, but it breaks my heart because I followed what the FDA said. I watched all of the conversation during their approval process with the vaccine, whatever the heck it's called, VBRAC or whatever. It's the Vaccine Regulation Committee, which is comprised of a bunch of pharmaceutical executives and stuff like this, where they came out and they talked about how children have been exposed, how many children have been exposed and already have natural immunity. There's quite a few. So most of them didn't want to pass this for approval, but yet they did. They still did it. They still did it, even though they don't know what the outcome is going to be. Very, very concerning. And now what we just saw coming out of Aaron Siri with this letter, oops, I'm sorry guys, let me get back to here. With this letter, you see that here? This is from Aaron Siri on Substack. You guys can follow him. He's wonderful. This was reshared on Twitter, and let me take you down to her thread here. She's great. She shares a lot of great information. If you want to follow this person online, I'm sorry, I'm in the wrong spot here. But let me just show you her thread here that she has, because she has a direct link to Aaron Siri's Substack. If you could see that here, and I'll take you directly to the link. Actually, on Facebook, I could probably just, I'm going to put this right in my, you guys can see like everything here. Let me close down these things. I'm going to post this into the chat so you guys can have access to this right away. I apologize as I'm doing this in real time. I'm probably making you very dizzy. So I just want to post this in here. This is Aaron's series. Here we go. Hopefully that's in the right live there. I think it is. Okay, anyway. So this is Aaron's Siri. If you guys can see here that this isn't crazy. The FDA asked federal judge to grant it until the year 2076 to fully release Pfizer's COVID-19 vaccine data. Oh my gosh, I'm just like blown away by this. This to me is maddening. This is insanity. What do you mean that they want to wait till 2076? This is a game that they play to hide the information and the facts from us. It's not okay, and we need to say no more. Stop. You need to have full transparency the way that you said you would. And you're not having full transparency the way that you said you would by hiding this vital information. It is insanity, absolute insanity that this would even be the case, that that would even be considered as being okay, because it's just not okay. It's not okay in any way, shape, or form. So the other thing that's actually really good news, and this is OSHA is going to stop. Here, I'm going to pull this up for you guys too. So OSHA is not going to be enforcing the mandates. Now, what does that mean for people who've been fired? I'm not 100% sure what all that is going to mean for people who have been fired or have already lost their job. I would think that there's got to be some recourse for people to deal with this, because this is a very serious thing. When you're withholding, people will use the argument that, well, you know, people have had to get vaccines to go to school or to college or to travel for years now. Well, here's the thing. There's always been an avenue to opt out of that, whether it's a religious, medical, some states have had personal exemptions. We have never had a mandate like this on this scale ever in the United States, where you're now even being denied access into restaurants. So you're being denied access to working, being denied access to purchase food. And I just read that Austria is having a lockdown for anyone who's not vaccinated. And I also just heard, and I haven't confirmed this, I know Austria is 100% true, I have not confirmed this, but I read a brief headline today that Germany is also going to be doing the same thing, denying certain aspects of life, like living in society, like going into shops and public places, unless you are vaccinated, which to me this is nothing like we've ever seen in the United States before. So OSHA has suspended activities related to the implementation enforcement of its ETS pending future developments in litigation. That's really big, guys. So a bunch of lawsuits have shook up this mandate thing. It's like Biden put this out there, makes this announcement. Nothing's even written up at this point. The press never calls him out on it. He just makes this executive order out of nothing, out of literally thin air. There's nothing written about it. There's nothing until a month later. OSHA comes out with what they're going to do. And when I found out in the process of that, and I had no idea right away that this was just like a felonious. It was just, he just said it. He was like bluffing, really. And he had nothing to back it. There was no mandate. There was no executive order. There was nothing. It was just something he spoke, and the press never even followed it, the mainstream press. So it came out a little while later that there was nothing. There was nothing, and that as soon as OSHA put out their guidance or whatever they're going to do that Biden said they had to, they're being sued, which is what was said was going to happen, because it's completely illegal. And it's just mind-blowing that this kind of thing can actually happen, that these things can actually happen in the world that we're living in today. And I am absolutely blown away by this. So thankfully, people have sued. Hold the line. Hold the line. We must hold the line now more than ever. Any time in our whole history of our lifetime have we needed to stand up and speak out and support those who are putting their reputations on the line and their jobs on the line by saying no to tyranny, to support doctors and nurses who are coming out and saying no to tyranny, no to doing this. And I gotta say, one of my pet peeves when people say this, it drives me crazy because it just is where we're at. I'm not anti-vax. I'm not anti-vax. I'm not anti-vax. You know what? Anti-vax is a pejorative term that was created in a think tank to demoralize people who question vaccines. Yes, there are some people who absolutely don't want any vaccines, and I guess you could label them anti-vax, but I would say 90% of people are really thinking about what they want for themselves and not for others. So when you say anti-vax, it's like you're just against vaccines or anyone taking them. Me personally, and I'll speak for myself, whatever it is you want to do, there are people in my life who I love who have been vaccinated. You know what? I still hug them. I still see them. I'm not going to live in fear. I'm not going to do that. I'm not going to mistreat someone because I'm worried about this, that, and the other thing. And let me tell you something. There is something to be said about the shedding of spike proteins. I'm not saying that's not real and that doesn't exist, but I cannot live my life in fear. So I take really good care of my health, and I just, when I'm around people who are recently vaccinated, just make sure that I up my vitamin C intake and watch my immune system and pay attention to any symptoms that could develop in my body. So far, so good. I refuse to deny somebody based on their status of being injected. So, and questioning mandates and questioning the ingredients in these products that are liability free doesn't make me anti anything. It makes me a thinking person. It makes me someone who questions. And what has happened in our media is they're dumbed down. So Channel 8 is doing stories of the unvaccinated, and it's pathetic. You should check it out. It's a great example of propaganda. Propaganda. This is what it looks like. Anyway, so I'm not going to go off on that tangent. I wanted to share with you an experience that I recently had in New York City with segregation. And it was very disturbing to be, I'm not in New York City for pleasure. I'm not going to get into the reasons why I'm down in the city right now. I will talk more about that experience as it comes to me, but I wanted to share with you about my experience with segregation, which was really disturbing because I've never in my lifetime been denied entry into a place because of a vaccine. I don't think any of us really have ever been denied access into a place because of your status. It's crazy. So this was outside of a restaurant in New York City. This isn't the restaurant I tried to get into. I was walking around. I had parked my car and I was going to another location that I needed to be at, and I saw this really blatant sign, so I took a photograph of it. It was later on that I went into a restaurant and I just walked in. I walked past. They have signs all over New York City that say, not like quite as bad as what I'm showing you right now. This was like really over the top. But like all of them have signs. So I walk into a restaurant, he's grabbing, hey, I want to sit down, 3 people, please. And immediately asks me for my vaccine card. I'm like, what? Oh yeah, we need to see your papers. Show me your papers? Show me your papers. Okay, comrade. Are people sleeping in history class? Let me just tell you this. Austria is locking down people who are not vaccinated. Austria! Germany wants to lock down people who are not vaccinated. I haven't verified that story. I just saw that headline. I need to verify that. I'm going to verify that. But that's what I'm seeing. But we know Austria already is. We know that Australia is really, Victoria is just insane right now. So they're locking people down and excluding them from services in public places for their vax status. Now let me just say, this is a liability-free product. You're heavily censored. I'm heavily censored for talking about this. This video could be taken down. I could be put into Facebook jail. I put my stuff up on Rumble, and it's up there, so you can follow me on Rumble. You can also visit my website at jcherrypresents.com. Unfortunately, I took away that cool little thing that I had to get to my website. But at jcherrypresents.com, I put my videos there as well, because I'm just not going to let censorship stop me from talking about this. And we should all be concerned when we're just having honest conversations and asking questions like, why does the documentation in the Pfizer thing say this? Why is it saying that that they're the worst case scenarios for myocarditis? And you can see when you're reading through this, the literature and their own data. Okay, this is all from Pfizer. All this stuff that I'm showing you right now is from Pfizer. Actually, this is the FDA approval letter to Pfizer acknowledging that there are vaccine-associated myocarditis and pericarditis in the most clinically significant identified risk. This is coming directly from Pfizer. This is directly off of the package insert from Pfizer saying they don't have any information. They don't know the long-term effects of this. Pfizer. So, yeah, it's just insane. I'm beside myself upset with this kind of stuff. So, being discriminated against in New York City, which I gotta say, okay, I grew up in New York. I learned how to drive in the Bronx. I like to drive down to the city. I have to be there for reasons that are not about pleasure or going to see a show, and it doesn't really matter why I need to be down there. But if you're walking in to get served food, you're cold, you're tired, you're hungry, you just want to sit down, recharge your batteries before you get back in the car and make a long drive home. To be denied that feels like such an assault. It is like, I love New York City. I grew up going to New York City on a regular basis with my family, and then as a teenager by myself, and then when I was driving into the city. I love New York City. It is not okay. I can't just say screw it. It doesn't matter. That's just New York City. Let it go. No. I'm pissed. This is wrong. How is this happening right now? How are we allowing these people to destroy our freedoms and our country? It's not freedom. When people make fun of you for standing up for medical freedom, it's really sad. How have we gotten here? What place have we entered that this is the case now? So I really flabbergasted. I have one more video that I want to share with you, and hopefully that I didn't completely lose this here with you guys. Hold on a second while I go pull this up. So one more video I want to share with you. The FDA approval process is just insane to me. Watching that whole thing and seeing them talk about this, and this here, let me just pull this up. I might have already shared this video with you. Okay, here's this one. This is a doctor. And just listen to what he has to say, because I was blown away by this. I did not know this was the case. So let me just share this with you. I might get this on the share screen here. Let me just share this with you. This is on my Twitter feed. I have this pinned that you can see this and share it. And if you follow me on Telegram, it's J Cherry Presents on Telegram too. I put a lot of these videos. They're short. They're just clips from the FDA. This is the FDA meeting on the approval process for it was like the first step, and then ACIP voted it in. So this was the first step where they had the experts come in. They're all medical people that are all revolving door with pharma. And when you hear them talking about their concerns, they're voting on this with heavy heart. You're flabbergasted that they voted to approve this. So take a look at this video. I'm going to rewind it back here. Here we go.
Thank you, Dr. Monto. Well, I have several thoughts here. And one of the things that's really been impactful for me is to learn that the prevalence in children might already be 42%, which means that 30 million of the 72 million children in our country may have some form of immunity to the virus already. The other thing is that I was disappointed that the number of minorities in the Pfizer study was such a small percentage of the total, because they bear the brunt of disease and hospitalizations. And it just seems to me that in some ways we're vaccinating children to protect the adults, and it should be the other way around, that if 30 million children already have some form of immunity, they've made their contribution to herd immunity already, and our focus should be to get the adults vaccinated to protect the children. So this is a really tough one for me, but I do believe that children at highest risk do need to be vaccinated, but vaccinating all of the children to achieve that just seems a bit much for me. So I'm having some challenges with this one. But those are my thoughts, Dr. Monto. Thank you.
that 30 million children, and the CDC recognizes this, okay? I didn't hear about this in the mainstream news outlets. I mean, I don't watch regular TV. I don't even have cable. I just don't. And I am not hearing it on the mainstream, like not seeing it in New York Times, not seeing it in Hartford Courant, not seeing it in any of these things. And I'll follow local news via social media and what they're putting out there, their headlines. Like I know that I have to play a clip of this for News 8 and their faces of the unvaccinated, because it's unbelievable. I just want to play you guys a clip of this. I should have pulled this up earlier. But it's so absolutely unbelievable, the level of propaganda that's in this. Like they have this nurse that they're interviewing. I'm going to play this for you. I don't know if you saw it. So anyway, the mainstream isn't talking about any of this, right? They're just not. The mantra is, so with this program, The Faces of the Unvaccinated, that News 8 is airing, the host gets on there and talk about the majority of people are vaccinated, including him, and people have misinformation and all this kind of stuff. And I'm like, wow, is this an editorial or is this supposed to be a journalistic piece? Because all of your personal private information is irrelevant to the discussion here, that you're talking about people who are not vaccinated. I refuse to call it unvaccinated. You cannot be unvaccinated. Once you are vaccinated, you're vaccinated. You can't get uninjected. You're injected, you're injected. That's it. Period. I don't want it. I'm not hesitant. And whatever, just say not vaccinated might be a better way to put it. I think people would think that way. So here we go. Take a look at this. So here's a clip. Hold on a second, guys, while I pull this in for you.
People in the state who are eligible have been vaccinated against COVID, just over 70%. But there are still thousands out there who refuse to get the vaccine. Who are they? And why won't they get that shot? All this week, we're going to be hearing their stories in our special series, Faces of the Unvaccinated. Tonight, a registered nurse who, despite having seen the ravages of COVID firsthand, will not take the vaccine.
I have seen what the patients go through. I've seen 55-year-old strong men succumb to this, and it's devastating what this virus can do to somebody.
But you won't get the shot?
No.
Camille is a registered nurse at a major Connecticut hospital. She's worked the COVID ward, watched people suffer and die. She even caught COVID from a patient who died from it, and still she refuses to be vaccinated.
I feel just everything was rushed. I don't feel there's enough evidence to make an educated decision on if the vaccine is safe and effective.
I do agree with that level of suspicion and that way of questioning it.
Keith Grant is the Senior System Director for Infection Prevention at Hartford Healthcare. He says vaccine development was historically fast, and it worked.
I've had more than one person say, look, we're in a big clinical trial. This thing still isn't scientifically proven. They don't know. We're still part of the big test.
Over 5 billion people have gotten the vaccine. The impact on the vaccine, if you look in Europe, they are now having soccer games. A soccer game in Europe is 100,000 plus people.
Camille has a vaccine exemption from her hospital. They do test her regularly. She has 3 sons, all unvaccinated too. Her 16-year-old wants the shot, but she won't let him get it.
My 16-year-old has asked me several times, can I just get vaccinated?
And what'd you tell him?
I said no. Until you're 18, you can make your decision. But for now, I think by that time, we'll have more evidence and more knowledge.
There are people who are going to hear that and gasp. What do you say to them?
What it comes down to is people being able to make the right decisions for their own family.
Is there a part of you that wants to protect your sons from that?
From COVID? Absolutely. Absolutely, but they're kids. I feel like they'd be able to bounce right back.
It's playing the odds. Yes, you're right. Most kids do very well with COVID-19, but you add vaccines to that and you add your masking and you add proper social distance, it puts you in a much better position. And this is not a position that is preventing anything but death. I mean, that's I think that's a big thing.
Where do you get your information about all this?
I'm getting a bachelor's program, so like, I know where to go for good, media, obviously not.
Is politics part of where you're coming?
So up here in this corner, the woman has a Trump flag. So it's like a subliminal thing, like, oh, look, here's a Trump supporter. I see this as like the media likes to spin this as like it's a Trump thing. And it's not about like who's running for president or who was president. It's way bigger than that. And there are many people and I think her reasoning and what she's saying is very reasonable. And then, like, they do this long shot. So just look at the long shot. They're doing that on purpose. It's totally planned. That's why they have the long shot with the flag up in there. And honestly, on social media, instead of the discussion being about bodily autonomy and why this nurse wouldn't want this product that is liability free and comes with things that we don't even know could be the long-term outcome, is saying she doesn't want it. Instead of the discussion remaining on that, somebody's talking about how she has a Trump flag hanging. So the discussion goes from, about medical freedom to politics. And though she is admitting she feels political about it, that's not really the point. It's not politics to say I want to have autonomy over my own body. That's basic human rights. It's not political. It's basic human inalienable rights. It's maddening to me what they do, the manipulation they use.
Coming from with this?
For me, yeah, it's about freedom. I think the government should not be able to tell us what to put in our bodies.
Camille says while her fight over the COVID vaccine goes on, her number one concern has never changed.
And our number one concern is our patients. No matter what.
Tomorrow night, we will introduce you to a New Haven pastor at a predominantly black church. He says the black community does not want to be bullied into taking a vaccine, and he says you cannot trust the science. That's tomorrow night at 11.
So you guys could watch the whole series yourselves, and I really suggest that you check it out just to see the different stories. The people that are sharing their stories with something like WTNH, I give them credit for, walking into the lion's den, so to speak. So they're very biased. The host is biased. He presents his biases out there, just plain and simple. I could say, yes, I feel a bias too. Medical freedom is a human right that I want to defend. I will back that up with facts, not just opinion. So many people, 5 billion people have had this and blah, blah, blah. But if we look at VAERS and we see the reportings to VAERS, because the doctor in that video is saying, 5 billion people have had it, and something like that, whatever number he said. Billions of people have had it, no problems. But I would say, as the reporter, why aren't you asking about VAERS? And the spike in reports of all kinds of issues, from death to myocarditis to all these things that we've never seen out of VAERS that's been around since 1986, the Vaccine Injury Act. See, journalists aren't asking these questions like, why does Pfizer, if it's so great, need to be liability free? And then questions like, well, what about some of the trial participants that were in these trials that have been injured that have grievances now that Pfizer isn't paying their medical bills and is ignoring them and wiping them from the data? This is true stuff. Senator, where is he out of? Ron Johnson, I want to say. Senator Ron Johnson, I could be wrong on that, but he recently did a hearing with the injured a couple weeks ago, and it was really pretty profound. And I'll have more to say about that. I'll maybe take some videos and try to share little clips of that with you guys. But that's all for now. I just wanted to say OSHA backs off. let's just go here. The Aaron Siri, please, if you're not already, I highly recommend that you follow him on Substack. He is, I think, one of the greatest attorneys. I love what he is doing to help defend our inalienable rights. I think the work of ICANN and Aaron Siri and the Highwire, Del Bigtree's phenomenal stuff. And I'm thankful that there are folks like this fighting for these basic things. I'm sorry, I keep mixing up OSHA and the FDA. This was the FDA saying that they wanted to have till 2076. And then the last thing that I'll share with you is the OSHA. Oh, just real quick, since I'm passing by, Disney Cruise Line to require kids as young as 5 years old to be vaccinated to go on their Disney cruise, which is pretty crazy stuff. But the last thing I'll leave you guys with is the good news that we got today, that OSHA is not going to be enforcing this right now. There's still a very large battle. It's a battle that we all need to fight together. The future is a really scary place if we can't even make our own medical decisions. If you cannot decide what is going into your very own body, are you free? That's the question I want to leave people with. If you cannot decide what goes into your body, and the government is deciding that for you, saying you cannot work if you don't get this thing. You cannot go into public places if you don't get this thing. Your child can't attend school or go on a plane or travel. Are we free if the government decides? And then when is enough enough? Do you know they are changing the definition of what it means to be fully vaccinated? It is going to be 3 shots, okay? Fauci has already said this. This is already happening in Israel, who are ahead of us. When will it be enough? And are you going to do that every year? Every single year of the rest of your life? Are you going to set your children up on this trajectory too, that every year for the rest of their lives, they're going to have whatever shots the government says they have to have because we allowed them to mandate these medical products that are liability free to the people in the first place? When is enough enough? The media has failed us. The media is not asking the questions that it should be. It's failed in its journalistic integrity. I think every journalist probably has some bias, right, in a story. I think it's hard as a human being not to have that. And I think when you're working in journalism, you want to present all of the sides, all of the facts. And that's not happening in the world that we're living in now. You have one expert in that video, The Faces of the Unvaccinated, one expert who's pro-vaccine. You don't have any other experts or scientists, but there are many out there who would tell you that they support this nurse's position and think that you should have the right to make these decisions for yourself. They don't do that. And that's a big part of the problem. It's a bias in reporting and presenting this narrative. And they don't pick you in journalism these days for your journalistic qualities. They pick people who are going to toe the line. And journalism, there was the thing I was thinking about the other day where it's like journalism is all about makeup and personality these days. Because when you look at these heavily made up people, look at how made up this guy is. One more time, and I'm really going to end this live. So look at how heavily made up this guy is. And look at him. He has got more makeup on than I do. Anyway, I mean, the Smith-Mundt Modernization Act. That's how we got here, guys. Seriously. Look that up. Smith-Mundt Modernization Act, buried in the National Defense Authorization Act of 2012, passed into law in 2013. It became effective. That is where our own government uses propaganda on the people of the United States. The Smith-Mundt was established back during World War II and World War II, and it was to send propaganda to other countries about the United States. And so the Smith-Mundt was the means to say you can't propagandize your own people. But that's where we're at. That's what Russia did. That's what North Korea does. That's what China does. And now the United States is using the same tactics, telling you that you're free, but you're not. you're going to have to do what the government tells you. And then they'll pick on you and say, oh, you just want freedom. And they have no clue. They've been dumbed down. Stay strong, hold the line, don't back down. All of us, hands on deck to fight this tyranny. I'll be back live again, maybe later in a week. Been off for a little bit and wanted to get back into things. Had a great interview with Lorna, which you can see on my page as well. Lorna, the teacher who is resisting mandates and fighting every step of the way, and she's not going to give up this battle, and it's really quite fabulous how she's doing this. Actually, maybe I'll just close out with this little video of people supporting her. I just want to share this story out there about her not complying. It's such a great little video. So I'm going to close out with this and wrap it up now with this little bit. Here we go. This is Connecticut. This is Lorna, a local teacher who lost her job, and these are people out supporting her. It's a positive note to end on. What do you think of Governor Lamont's executive orders and mandates?
Tyrannical mandates?
Yes.
I think they're out of control. I think they'd have to shoot me with lead before they'd shoot me with their graphene oxide.
And so you're here today supporting Lorna?
100%.
Nice, nice. How about you? You want to speak for a minute?
Absolutely. I actually know, I've learned the contents of the vaccines. I personally know Dr. Robert Young, the cellular microbiologist that is blowing the lid on all this medical tyranny and poisoning. And if you ask me, it is a bioweapon. People have to do their homework. They're just blindly trust the government with these forced, unconstitutional mandates. Nobody seems to know what's really written in the Constitution. I know they don't. I'm not sure what they're getting in school concerning that, but everybody needs to start doing their homework and what it truly means to be an American.
What do you think about Ned? I really appreciate you, first of all. Thank you for standing up to the tyranny that we're experiencing. Tell me how you're feeling about our governor right now and these mandates and the situation that we're all out here for today with Lorna, the teacher that has been put on unpaid leave.
Yes, well, you hit me with how do I feel about the governor right out of the gate. It's hard for me to start off on a positive note with that, but I'm very delighted to be out here with a lot of patriotic people who are standing with another fearless freedom fighter, someone standing for what they believe in, and something that has everything to do with our country, which is our personal belief system, our personal health choices should be our own. And as far as the governor, I think the governor knows that he's overreaching. He's gone beyond his, stated authority, and it's time for him to give up his emergency powers. It's just way beyond that. Everybody knows that there's no public health emergency. I mean, COVID's still out there, but doesn't rise to the level of an emergency. It needs to end. And all of these mandates are a result of the governor having those powers that need to disappear today.
Amen to that.
So I will call on him right now. Governor, stop. End the emergency, end your emergency powers, restore freedom in Connecticut, the Constitution state.
Thank you so much. Senator Rob Sampson, thank you so much. You're out here supporting Lorna, so tell me about your situation and what you're facing with Governor Lamont's medical mandates.
Well, I'm a registered dental hygienist, and I was actually terminated the day after the police led me off the property. They were so confused, they didn't know what to do. They didn't know, they were kind of like shaking in their boots when I said I'm not leaving the property until you give me a termination paper. And they refused to do that. And then they said, well, maybe we should call the cops on her. So then they called the cops because they didn't, they wouldn't just terminate me. They were trying to get me to leave the property. And I said, no, I wouldn't leave the property until you officially prove to me you're you're going to terminate me. Kind of like Lorna, and they didn't do it. So they called the cops, and the cops came, and they were really nice, but they looked at my employer like they were absolutely nuts. And they said to the employer, why didn't you just give her the termination paper? Why did you call the cops on her? Like, even the police, didn't want to, they didn't understand why they were there. But the long story is, this is horrible. It's all because I wouldn't take the jab.
what recently happened to you?
Recently been kind of taken out of my position as a teacher after 15 plus years in my building because I was not complying with the executive orders that we're faced here in Connecticut with. So it's been about a month that I've been out of school, away from the students that I love and I'm committed to. So it's been a little bit disheartening, but I feel invigorated by being able to stand up for what I believe in, being able to speak that to the masses and find so much support. You know, when you first take a stand against things that, you know, take an unpopular stance against the common narrative, you feel alone. And one of the reasons why I'm here today is to let Lorna know that she's not alone and there's people that are standing behind her. I've gotten word from people all across the world that have said that my voice is their voice right now. So I've been privileged to be put in this position. You know, my voice was shaking in the beginning, but now I found a lot of stability in it. So the message stays the same. I'm committed to my students. I want to continue to teach and continue to bless people with the wisdom that I've gained over my lifetime. And I'm hoping that I can continue to do that. But we should not be being told what to do with our medical procedures, with our health practices, and this just didn't sit right with me from the beginning, and unfortunately this is the consequence right now, but like I said before, it feels good to stand up and speak that truth.
Thank you for your courage. I really appreciate it.
You're welcome.
So tell me what you're doing now today and about tomorrow.
Yeah, so, you know, I chased the governor for a little bit, and I didn't feel like he was listening. I think most people feel that way. Because I originally chased the governor to have a conversation because he wasn't calling me back or returning my emails. And after months of chasing him, I decided that wasn't being effective either. And so I'm running for office. I'm running for Board of Ed in Naugatuck because we're going to make policy then and go around the governor because he doesn't have the right to rule all of our lives like a king. That's not how our country was made. And days like today when his rules and his leadership go against the Constitution of the state, the beliefs of the people who live here, and we have a teacher being discriminated against and segregated, we have to stand with them because we can't leave people to stand alone. Because if you let other people be taken, then when they come for you, there won't be anyone left to help you. So here we are, you know?
Great. And I said, why am I even being punished? I don't want to put anything in my body against my will. I don't want to do a testing that I think is a lie. You know, so what is the punishment even for? Have to go, well, the way the union rep said it is they're going to have to go through the process that they skipped. Like, first I get a warning, and then I get suspension, and then I'm insubordinate, because I will be insubordinate. Oh well, because I'm not getting it.
Did you negotiate the spit test?
No.
Okay. Just asking, just a question.
No, because it's a lie.
That's right.
Oh, I understand.
Yeah.
But I'm just saying, for your own situation and getting back to your kids,
Yeah.
If they would succumb to that part of it.
It all started with a mask. And now our kids, it all started with a mask, and now all our kids, 2 years into it, they're still robbed of their childhood, having to suffocate in class all day. And the testing is just the same thing. It's like, again, it's discrimination, right? I know. Like, I would love to, I know what you're saying. I know what you're saying. Believe me, I would love to just go back and just like do the testing and have everything, my life be peaches and cream, and you know, I don't have to worry about pay anymore. I don't have to like have sleepless nights. But you know what? I'm not going to like myself either, because I'm doing something against what I believe is. I think it's wrong, and somebody has to stand up.
It is wrong. And somebody has to stand up. So stand with Lorna. Stand up for yourself. Stand up for your kids. I'll be back live to talk about more of the stuff going on in the world that we're living in today. Thank you for watching. And till we meet again in Cyberland.